When your blood pressure rises, especially during stress or doctor visits, your instinct may be to panic. But what if your body already holds the tools to bring it down, safely, naturally, within a minute? Today, I'll show you 3 body-based techniques that calm the nervous system and lower blood pressure. No pills, no panic. You weren't born broken. Your nervous system already knows how to lower blood pressure. It's just that no one ever taught you how to use it. This video isn't just about hacks, it's about reconnection. Let's walk through 3 proven, science-backed ways to help your body reset pressure from the inside out. 1. The nerve behind your neck that calms the storm. You don't need to wait for medication to feel safer. Sometimes the fastest way to calm your blood pressure is already in your neck. Quiet, unnoticed, and ready to help. It's called your carotid sinus. Tucked just below the jaw, where your neck pulses gently, is a pressure sensor wired directly to your nervous system. This sensor, called a baroreceptor, detects changes in blood pressure and instantly signals your brain to adjust. Metaphor. Think of it like a reset switch for your heart's rhythm. Not a forceful slap, but a gentle tap that tells your nervous system, you can settle now. When stimulated correctly, this tiny region triggers your vagus nerve, slows your heart rate, relaxes your arteries, and brings your blood pressure down, naturally. A 2021 study in clinical autonomic research showed that gentle carotid sinus massage significantly activated parasympathetic tone, the system responsible for rest and calm, especially in patients with elevated blood pressure or anxiety-related spikes. But here's the key. It must be done gently. Ritual to try, carotid, reset practice. Sit comfortably, breathe slowly, find the spot just below your jawline, along the side of your neck, where your pulse is strong, one side at a time. Using 2 to 3 fingers, gently massage in small circles. Light pressure for 5 to 10 seconds. No pushing, no pulsing or squeezing. Think. Petting a nervous animal. Repeat on the other side if desired. Sit quietly for 30 seconds. Notice if your breath slows, your chest softens, your head clears. Important. Do not use this method if you have known carotid artery disease or plaque. Never massage both sides at once. Always ask your doctor first if you've had a stroke, TIA, or are on blood thinners. This technique isn't a replacement for long-term care, but it can be a bridge between panic and presence, between rising pressure and grounded regulation. So ask yourself, next time your heart races, can I reach for calm before I reach for fear? Sometimes healing isn't about adding something. It's about activating what's already built in. 2. The breath hold that reboots your heart rhythm. Sometimes your heart doesn't need a pill. It just needs a pause and a chance to reset. There's a simple maneuver rooted in your own breath that taps directly into the baroreflex system, the body's pressure balancing circuit. It's called the Valsalva maneuver. Metaphor. Think of your heart like a computer that's lagging. The pressure's building. Signals are stuck. You don't need to break it. You just need to reboot the system. The Valsalva does exactly that. By creating controlled pressure in your chest, you send a message to your brainstem that prompts the vagus nerve to slow down heart rate and regulate blood pressure within seconds. A 2019 study in the Journal of Physiology showed that the Valsalva maneuver increased baroreflex sensitivity in adults with hypertension and temporarily reduced blood pressure by improving nervous system regulation. And yes, it's safe, simple, and can be done anywhere. Ritual to try, Valsalva heart. Reset, sit down, or stand in a safe, grounded position. Take a deep breath in through your nose. Close your mouth and pinch your nose shut. Now, bear down gently, like you're straining during a bowel movement. Keep pressure in your chest, not in your face. Hold for 5 to 10 seconds, then slowly release. Breathe normally and sit quietly for 30 seconds. Repeat only once or twice, and not more than once per hour. Safety notes: avoid if you have uncontrolled blood pressure spikes, retinal problems, or risk of stroke. Always consult your physician if unsure. Don't use this if feeling dizzy or faint. Why does it work? The sudden rise in intrathoracic pressure from the hold activates the same reflexes your body uses when trying to stabilize after exertion, coughing, or straining. But here, you're doing it on purpose, as a tool, as a signal of trust. Because your body doesn't just respond to panic, it responds to patterned resistance and intentional release. So next time your heart feels like it's spinning, ask softly, "Can I create space just long enough for my rhythm to return?" Sometimes the most powerful intervention isn't louder effort. It's a held breath followed by letting go. Dest. 3. Breathe like the body knows rhythmic reset. You breathe more than 20,000 times a day. But how many of those breaths actually help you heal? Most people breathe too fast, too shallow, and through their mouth. And over time, this tells the body, we're not safe. But there's another way. A rhythm your body already knows, one that lowers pressure, expands vessels, and restores calm. It's called rhythmic nasal breathing, and it's not a meditation. It's biology. Metaphor. Each breath is a whisper to the heart. You're safe. You don't have to push so hard. When done correctly, rhythmic breathing stimulates nitric oxide production in the nose, relaxes vascular walls, activates the vagus nerve, your calm switch, reduces cortisol, inflammation, and resting blood pressure. A 2020 study in the American Journal of Hypertension found that slow nasal breathing for 10 minutes a day significantly increased nitric oxide output, resulting in an average BP reduction of 5 to 8 millimeters of mercury within 1 week. This is not magic. It's mechanism. Ritual to try. The 4-4-6-2 reset. Do this while sitting, standing, or even lying in bed. Inhale through the nose for 4 seconds. Hold your breath gently for 4 seconds. Exhale through the nose for 6 seconds. Pause after the exhale for 2 seconds. Repeat this for 5 rounds or 2 to 3 minutes. Bonus, place one hand on your chest, one on your belly. Make sure the belly rises first. This is diaphragmatic breathing. Do this before sleep, after meals, or when feeling tense. Within minutes, you may notice heart rate slows, muscles soften, thoughts quiet. Why? Because you're activating what the nervous system was built to do: recover. This isn't a meditation class. It's your physiology reawakened. So next time you feel your chest tighten, your pressure rise, your mind race, ask yourself, am I breathing to survive or breathing to regulate? Because one breath, done well, can become a signal your entire body has been waiting for. 4. Your long-term pressure fix starts in the kitchen. Quick techniques work, but if you want pressure that stays stable, not just today, but next week, next year, you have to go deeper. And that starts with what you eat, because every bite you take is either fuel for inflammation or a gentle pressure regulator in disguise. Metaphor. Food is not just fuel, it's pharmacy-grade information. Each meal is a message, either open up and flow, or tighten, hold, and strain. Here's the physiology. Magnesium relaxes vascular, smooth muscle. Potassium helps your kidneys excrete excess sodium. Nitrates from vegetables like beets convert to nitric oxide, leading to vasodilation. Too much sodium, especially from processed foods, stiffens arteries and retains fluid. The original DASH trial, funded by the NIH, showed that increasing leafy greens, whole grains, and reducing sodium could drop systolic blood pressure by 11 millimeters of mercury within just 14 days, without medication. Ritual to try. The 3x3 blood pressure plate. Try to integrate these 3 core nutrients daily from whole foods: magnesium, 1 handful pumpkin seeds or 1/2 cup black beans; potassium, 1 banana or 1 cup spinach or sweet potato; nitrates, 1 beet or 2 cups mixed leafy greens; sodium. Strategy: keep sodium below 1,500 milligrams per day. If hypertensive, watch hidden sources: breads, sauces, canned soups, deli meats. Weekly practice: 20 minutes of brisk walking per day. Try adding 1 teaspoon raw garlic to meals, natural ACE inhibitor. Drink 8 to 10 cups of water per day. front-loaded before 6 p.m. This isn't a diet. It's not about restriction. It's about consistency, about flooding the body with the right signals, so your vessels stop bracing and start flowing again. Because blood pressure isn't just about stress. It's about what's been missing at the cellular level for years. So, before the next spike, ask, is my plate a partner in healing, or a silent part of the pressure I'm trying to lower? Food doesn't replace quick fixes, but it's the only long-term fix your body can absorb, day after day, for life. We've been taught to fear the numbers, to panic when the cuff tightens, to believe that a rising pressure means something is broken or that control must come from outside. But what if your body isn't broken? What if the systems that once kept your pressure in check are still there? Quiet, a little rusty, but waiting for you to tap them back on? The baroreceptors in your neck, the stretch sensors in your lungs, the chemical messengers in your nose, the smooth muscle in your arteries, softening when you feed it the right minerals. You are not a machine, but you are a system. And systems, when gently reminded of rhythm, can reset, not with force, not with fear, but with practice, presence, and a little trust. So, before you reach for panic, reach for something older. Your breath, your pressure points, your rhythms. Because control doesn't start in the arm cuff. It starts in the way you relate to your body. So, ask softly, what if my body remembers? How to heal itself? If I just listen long enough to give it the chance. You don't need to fix everything at once. Just start with one, a neck massage. A breath, hold a quiet round of box breathing, or one small plate of beetroot and greens. Try it today. Repeat for 5 days. Track what shifts, not just your blood pressure, but your sense of safety in your own body. Which technique felt the most calming for you? Which one surprised you the most? Leave a comment below. Someone reading might need the reminder that healing is this simple. You are not powerless. You are not fragile. You are built with systems that have protected you for decades. Now, in this stage of life, you get to partner with them. Not control them, but collaborate with their wisdom. Because blood pressure isn't just a number, it's a rhythm. And rhythm, once remembered, is something your body will never forget.